All right.
We did it.
Yeah. Always the hardest part we say.
I think it is actually. Medical school is a pinch compared to this.
Yeah. Welcome. Well, I was
Thank you.
saying most people are not new to seeing you here, but I'm so excited to have you back.
Good to see you.
Uh, Vytal University. So
yeah, this is a new one.
Yes. And happy Valentine's Day, by the way.
Thank you. Absolutely. You
Thank
too.
you. All right. Well, let's dive right in. So Vytal Health just, January, launched Vytal University. So tell us what it's all about, why you created this new option.
Yeah, so I think the idea behind this was I hear a lot from people who are interested in diving into a health condition. They want to know more about a health condition. They want to learn about something, and they kind of want to do it independently. They want to learn on their own. They want to kind of get some sense of whether or not working with a functional medicine doctor on a problem is right for them. Mm-hmm. And so what I thought would be really helpful would be to get some of the best and brightest minds at Vytal Health to come forward with teachings around particular clinical topics that I think are really common problems that we see in functional medicine, and allow people to learn about the topic, kind of self-identify a little bit around, is this true for me? I think I have this problem. Is it real? Do I think I have it? Can I confirm it? And then besides the teachings, the other piece that's really helpful is there's a test kit that patients can purchase directly. And so it brings together the knowledge base of a functional medicine approach, and then the ability to order independently a functional medicine test, do it in the comfort of your own home, do the test, and then bring your results so that you can go through the results on a sort of line-by-line basis. And during the course, the final kind of presentation or teaching is, how do I understand my results in context of the piece of paper or the online results that I'm actually looking at? So it's really a great way to sort of be able to have agency around your health and be able to understand what it is that you may or may not experience, validate it, or sort of maybe pivot it from, oh, this isn't actually what is going on with me. I want to look at something else. So it's just a very cool way to become independent in your medical adventure.
Yeah, I love that. And that actually makes me think of even just this last time around, this last summer, being diagnosed with adrenal fatigue. I feel like time I really sunk into it more and learned as much as I could, but also I was more in tune with like, what is going on? Why does this keep coming up? And I think that's really important because at the end of the day, like our bodies are all so different, biochemistry. So it's like we really do have to, kind of step into our power and ownership over not always outsourcing our health or feeling like, I don't know what to do. And then it's so much better than just Googling where you can find a whole mess of
it. I kind of feel like it's information overload, right? And it's like, who's the credible voice in this space? I mean, there's lots of people who know a lot about medical stuff, but like, who are they and what do they actually bring to the table and what's their training and background? And I'm not saying that people who come from functional medicine are the only voices. And in fact, I would argue there's lots of different incredible physicians and clinicians out there who offer help in this realm. But, if you have somebody that you feel like is speaking your language and understands how to talk to you and makes things not only understandable, but sort of actionable, and you feel as though that is a voice that you want to have be your teacher, even if you don't necessarily want to partner with them as a clinician right away, I think that's helpful, because I do think there's just like a lot of noise out there and it gets really overwhelming. Even for me, it gets totally overwhelming.
Totally. Yeah. Well, and then it also makes me think of, from working with you, I've always loved that when we go over test results, you screen share and we really do go through it. So I think that's really different from experiences I've had in the past, where like kind of an authority figure is just like reading to you or telling you like, here's what's happening and here's what you do, without really bringing you on board to fully understand what's going on and like look at all of this. Because again, once you see it, that's just, knowledge is power.
Yeah, totally. Mm-hmm. And I feel like that's the best case scenario, honestly. If somebody would actually sit with you or explain what are the results showing and not showing. So I think one of my biggest pet peeves in healthcare, and I have so many of them, I have an endless scroll of pet peeves, but one of the biggest ones is that so often people do tests. They give blood, they give bodily substances, they go into machines, they do incredibly challenging and difficult things, and then what they receive back is maybe nothing, which is terrible, or everything looks fine,
Yep.
or nothing is wrong, and what I often see is that doesn't even come from the doctor who's overseeing the care. It's coming from some middle person, like a medical assistant or a nurse, and sometimes that's okay, but my gosh, it just leaves you with so many unanswered questions, and really the inability to get those questions answered. If you're talking to a medical assistant, you may have several deeper level questions that they can't answer, and then it becomes this game of ping pong, and I mean, it's just a mess. So to be able to sit with somebody or sit with your own results and have somebody walk you through, here's what was tested, here's how to look at a normal, here's how to look at an abnormal, here's what a borderline test might mean, and be very clear on what all those biomarkers are standing for and not standing for. And then what can you do about it?
Mm-hmm.
If you have test results that are abnormal in these areas, what can you actually do to improve it on your own? You may just need to make some changes to the way that you exercise, or certain foods that you eat, or approaches to the way that you're managing your stress, mm-hmm. that are absolutely well within your wheelhouse as an individual to make on your own and try. And sometimes that's all you need to do. Mm-hmm. Try these supplements, take this. You know, it's a way to, I think the agency piece comes to mind for me over and over again, because I think people can do some of these things on their own without having to invest huge dollar sums into clinical care. And then if they want to partner with a doc, they absolutely can. Mm-hmm. You know, they can see a doctor within Vytal Health, or they can see a doctor outside of Vytal Health and say, look, I started this process. I'm intrigued. I have had a little bit of success, or I haven't, and now I want to go further. And then they're really on their way to having a better relationship and a better understanding of what's going on and what's not going on. So I think it's a great thing to be an independent scientist and of one scientist.
Yeah, I love that. So there's 3 courses right now at Vytal YOUniversity, and there's adrenal fatigue, thyroid, and fertility.
Yes.
So I'd love to hear how someone would know. I feel like fertility might be a little bit more cut and dry, mm-hmm. but people who maybe don't know adrenal fatigue, thyroid, like something's going on, which might be the right path for them. Yeah. What are some signs or some things that, you know, would maybe indicate that they could look into that?
Absolutely. Well, I think from an adrenal fatigue standpoint, I mean, you and I have spent a lot of time talking about this really super common problem that presents itself in a lot of different symptoms. The pervasive fatigue, the tired and wired feeling. You know, I go to bed and I'm exhausted, but I can't close my eyes because my brain is on hyperdrive and my body feels activated. Unexplained weight gain, you know, changes in menstrual cycle, changes in mood, weight gain around the center of the body where that's not typical for some people. So the adrenal fatigue piece, I think, is it's common enough that probably everyone should look at their adrenal function. And it is not something that traditional healthcare does at all. I mean, they just simply do not recognize adrenal fatigue as a clinical problem. So being able to do that on your own and measure your own cortisol levels over 24 hours and do your own DHEA level, I mean, those are really empowering things to be able to discover where you're at, and then figure out, if you do have adrenal fatigue, which of the 3 sort of tiers or phases of adrenal fatigue are you in? So that's a real, I mean, across the board, pretty much all of us could stand to benefit from that course. The thyroid course is really meant for people who have a family history of thyroid or have thyroid symptoms, typically hypothyroid, so weight gain, cold intolerance, changes in menstrual cycle, hair, skin, and nails changes, all of those kind of typical thyroid symptoms. And they go in to see their doctor, and the doctor, they say, you know, I think I have a thyroid issue. And the doctor says, okay, well, let's do a test. And they do the TSH test. And the patient is saying, no, there's many more tests that can be done here to look at this problem from all different angles. And the physician just simply does not believe them. So I really designed the thyroid course around that dismissal that so many people get around thyroid, and being able to obtain a more in-depth thyroid panel, all of the thyroid numbers, and then understand that in the larger context, and then what you can do about it. Sometimes it does require medication, but then you have results in hands, and you can actually say, like, look, here's the whole profile, and here's how, I see this as a hypothyroid situation. It also tests for hyperthyroid, but that's much less common, much rarer. And then the fertility one is actually, it's kind of under the auspices of fertility, but it's a hormone course, truthfully. It's couched in a fertility setting where we're talking about how different hormones affect fertility. But if you were just interested in exploring hormones generally, the test kit that's associated with that course is an in-depth hormone panel. Includes thyroid, includes cortisol. It's a very deep dive into sort of all the hormone families and how they all kind of come together. So there's some definite learnings within that course that aren't specific to fertility, although the fertility is kind of the main subject matter because it's so common.
Yeah. So it really sounds like these are all things that people could be very proactive about. A lot of my friends around this age, whether they're ready to start a family now or just, are thinking about it, I feel like it's a good thing to fully educate yourself, know where you're at. And
absolutely.
Like so many.
Yeah, the fertility course, I think the thing that we teach that Dr. Alicia McCubbins, who teaches the course, she does a great job of really talking about egg health. And I think we tend to not think about the health of our eggs and how we can optimize that, not just for fertility, but just for good, ovarian function. So there's a lot of material in there about how to approach being a healthy person and having healthy ovulation, healthy eggs, as one thinks about fertility, whether they're thinking about, having egg retrieval and banking eggs, or whether they're thinking about, future fertility and wanting to be just optimized and as healthy as they possibly can be going into that.
Mm-hmm. So would that course be a good one for anyone dealing with like irregular menstrual cycles or like bad PMS? Or
I think it can be helpful. Yeah, we're not addressing those symptoms specifically, but the testing can definitely be helpful. I definitely want to add on more hormonal courses because I do think that that's an area where people need more information. So that'll probably be the next thing. I'm also very interested in doing a gut health course. So we're just trying it out now and seeing, what the uptake looks like, and then building on that. I think Vytal YOUniversity will become more of a hub for learning and self-testing as time goes on. And I think it's kind of helpful for people to be able to take the driver's wheel, the steering wheel, and be able to do what they want to do and figure out as much as they can on their own without having to commit to, 6 months, 12 months. That's not for everybody. What we offer at Vytal Health is not for every single person. There are people out there who can, on their own or with very little intervention, really get what they need to get. So,
yeah, I love that. All right. So then we've kind of touched on it already, but can you walk us through the process of like, okay, I'm going to go with this route, adrenal fatigue or whichever one. What does the process look like, kind of step one and then through to the end?
So easy. Which everyone wants to hear that, right? So if you go to our website, at the very top nav bar, there's Vytal YOUniversity. It is YOU University, which, little play on words. If you click on that, it'll open the course page. And then at the very bottom of the page, the three courses that are being offered, the fertility one, the adrenal fatigue, and the thyroid. If you click on those, it'll open up a deeper dive page on that particular course. And it'll talk about what's included in the course and kind of how to self-recognize. Is this a course for me? Like, is this the right thing I should be checking? Or what are the symptoms that are, associated with this problem? And then within that page, there is a hyperlink to order the test kit. The test kit is not required. You can still take the course and not do the testing. It's not required. It's separate. So if you want to just learn about the topic but not do any testing, that's totally fine. You can take the course and not do the testing. But the link to do the testing is right within the page. You click on that, it's going to take you to our lab test kit shipper, which is Vytal Health is everything, right? Rupa Health. And Rupa actually processes the test kit, sends it to your home, walks you through how to do the test. So like, what are all the steps and what days do I need to test and all that kind of stuff. Oh, blatant self-promotion. and then, you send the test kit back to the vendor, and then they send you the results in your email box. So you don't have to go to Vytal Health to get the results. You can just get them right in your email box. download them to your laptop or your phone, and then you have them in hand to be able to go through the course. And so you enroll in the course on that page, you purchase your test kit on that page. And what I recommend people do is enroll in the course, start the course, get the test kit, because it's going to take about a week or so for the test kit to come to you. You can get the test done, send it off, and then right as you're nearing the end, where the last, as I mentioned, the last talk or the last piece of teaching is around, how do I look at these results? Then you actually have your results in hand, and you're like, okay, I've watched this course. I can look at my results all together as if you're sitting with a doctor, and then the test and the course concludes. You have as much time as you want. There's no time limit on it. So if you enroll in the course and you don't start it for 3 months, that's fine. It doesn't expire. So you can take the course whenever you want. You can take the course all in one day. You can do it, spread it out over months. It doesn't matter. It's totally self-paced, and so you don't have to worry about, like, okay, I've set up a whole bunch of time aside for this. Add more to your plate. Yeah. It's at your own pace.
Awesome. I was actually going to ask that too. Like the time, but yeah, that's awesome that you can kind of just space it out as needed.
Yeah, right. Sometimes you might want to look at something, think about it. Perhaps do your own research. Go back and look at some of the medical records that you have now that you have some context. So yeah, you can do the course however quickly or slowly you need to in order for it to be meaningful and helpful for you.
Yeah, love that. All right. And then finally, just a few general questions to close. So we were talking a lot about adrenal fatigue as usual. Mm-hmm. So what would be your top 3 tips for managing stress to prevent even getting to that point?
Top 3. Okay. I might have to come up with a third. I can definitely talk about top 2 for me. And I come at this as a physician, but I also come at this as a patient, because this was not an easy thing for me to learn myself. So number 1 is rest. Mm-hmm. So I think a lot of people who develop adrenal fatigue are people who push. I'm looking at you, Justine, and I'm looking at myself too. So people who push and push and push and push and don't recognize when the need for rest is there. And even if you're a superhuman like Justine and me, I'm kidding, of course, we all need to rest. And so what I always say is, the way that I can always tell for myself when my adrenals are off, and I know you have your own signals too, Justine, is when I go to do my exercise in the morning, I typically would feel very invigorated by exercise. And when my adrenals are not right, or I'm too tired to really be in the gym meaningfully, and I shouldn't be there, is I feel tired at the end of my workout instead of pumped up. Mm-hmm. So listening to your body, building rest into your repertoire is critically important. So don't think that you can power through. I have had people try to power through adrenal fatigue, and it has put them in a very severe stage 3 adrenal fatigue, which is hard to recover from. Not impossible, of course, but difficult. So just a way to get there. The second tip that I would have is, I hate the term self-care, because it sort of feels like doing more, like you have to do more, you have to go out and buy things, you have to do things. But one of the things I'm learning about myself is that recognizing when we're doing enough in our life and we really need to step back, and this kind of dovetails on number 1, which is the rest piece, but really understanding when we need to step back and reprioritize how we're spending our time, who we're giving our energy to, what we're giving our energy to, how we're managing our relationships. That doesn't feel like a medical thing. It seems more like a mental health thing, but the mind and the body and the spirit are one. And so when we're neglectful of our own needs and our own self-care, our own ability to take a moment and reprioritize and make sure that we're on the top of the list, then we are more likely than not going to have some degree of burnout / adrenal fatigue as a cause or as a consequence. So that I think that those are sort of not very, very medical answers, but I think that what we see in adrenal fatigue so often is not that somebody is doing something medically wrong. I mean, they may be eating not great, or maybe drinking too much alcohol, staying up too late. But what they're doing is just not listening to their body, not listening to their hearts, not listening to their soul. not paying attention to the signals that they're getting and trying to just keep going and pushing forward. So one of the things I did in the last year or so is I learned for the first time in many decades of living to ask for help. And asking for help is not easy for some of us. It was incredibly hard for me. But asking for help from a friend, from a partner, from a medical person, from anybody, a teacher, somebody in your life, to say, like, how can I improve this? What can I do differently? Or just have somebody listen to you, your therapist, etc. Asking for help is not a sign of weakness, it's a sign of strength. And that's what I had to learn. And I just think that's a very valuable piece of advice that I've been given that I'll share freely here.
Yes, I love that so much. Just taking this all in, and I saw lots of hearts go up during that too. So I know that's hitting home. And
Yeah.
I love that you said that too, because again, it hits home for me. Some of the times where I've gotten hit really hard with the adrenal fatigue, I was doing everything like quote unquote right, working out, really healthy. And so I love that you brought that up, because it's not always just about that. It's like, you know, what's going on a deeper level, on that, like, human, you know, our thoughts and feelings and how we're being day to day.
Absolutely. So, yeah, we can really get spinning, and when we're spinning, we just don't pay attention. And that's when the wheels come off us.
Okay, and then finally, another more broad general question. So this time of year, kind of home stretch of winter, we're starting to see a little more light, but pretty deep into winter. So any tips for people to feel their best at this time of year?
Yeah, again, I think this comes down to some great advice that a good close friend of mine gave me. I've always dreaded winter. I don't know how I managed to live in Wisconsin all these years, but I don't like the winter thing. And it's really not about so much the cold as much as it is about the light.
Yeah.
And so one of the things is surrounding yourself with light can be really helpful. And one might say, well, I mean, when it's gray and it's been super foggy here in Milwaukee, how are you supposed to get good light? Sometimes you have to do it the artificial way. So I'm a big fan of the full spectrum light sources. Very inexpensive little things that you can sit on your desk or someplace nearby when you're working or when you're getting ready in the morning, where you can get some full spectrum light into the back of the eyes, which hits the retina and then helps trigger appropriate sleep-wake cycles. There's some studies also looking at full spectrum light and seasonal affective disorder, which is a real thing. People who become bluesy during the winter, I'm one of them. It really, really helps a lot to do the full spectrum light. And then adequate levels of vitamin D. And when I say adequate, typically that's going to be 2,000, 4,000 international units of vitamin D3, widely available supplement over the counter. You can get a level done if you're not sure, like, well, is it 2 or is it 4 or is it more? Getting a vitamin D level can be done simply at home, and it's something that you can actually use to, do your, access which dose of vitamin D is best for you. So vitamin D and full spectrum light are kind of my go-tos for survival time in the winter. But I think the other thing that I got as a piece of advice from my good friend was just allowing winter to be winter. I mean, winter is an opportunity to self-reflect. And it's actually a new verb for me. To winter is to actually get into a headspace around what's happening in nature, which is the leaves are all off the tree. Everything looks very brown and dead. But what's actually happening is below the soil. It's down underneath the ground. There's roots being put down. That's happening. There are seasonal flowers and plants that are going to burst forth as soon as there's enough sunshine and daytime. They're all kind of germinating under there. So looking at that metaphor of we can germinate and grow as people, where it's not obviously outwardly, like we're not putting leaves on ourselves, but we're doing work inside to fuel the changes that we want to make in our life and understand ourselves better. So I do a lot of journaling this time of year. I've written a lot over the last few months. I take the opportunity to be snug as a bug in a rug in my place with my laptop and write and read and light a candle and think and feel and do all the things that I think sometimes may go by the wayside when we get super busy in the summer and we're out socializing and we're having a good time and we're all about being external. Winter is internal. adrenal. And there's nothing wrong with that. There's nothing wrong with being quiet and being maybe, expressing some sadness or some anger, or working through some of those emotions that maybe we don't deal with in the times of year where it's not sort of culturally appropriate to be upset. It's summer. You have nothing to be upset about. So those are my big tips, and I have seen a lot of, like, personally, I've seen a lot of real benefit to that. And this is sort of the first year I've done that, but it's been really helpful.
Yeah, I love that so much. And I've kind of naturally done that too, because people will say, like, oh, once the sun goes down, I kind of want to just like crawl into bed. And I'm like, a lot of nights I do that.
Just do it. Sleep.
Look.
Yes, be your best bear. Hibernate.
Yes. But I love that. And it makes me think of that quote, nothing in nature blooms year round. And like, we are part of that. So
Yes.
I think that not putting pressure on yourself to like, why don't I feel like, like it's okay to not feel, like you're motivated and like really outward every month of the year.
Yeah,
so
yeah. If you have a day like that, great. If you don't, take advantage of it and just be quiet. It's fine. There's nothing wrong with that.
Yeah, I love that. Such good advice. This was all so good as always.
Thank you, Justine. I know it does go by so fast. Thank you. I always appreciate the opportunity to be here, and I have this platform, and I think, your messaging and the things that you bring out, and all of your guests it's just great stuff. So keep going.
Thank you so much. And I will drop the link and all the resources. Will provide that information for Vytal University. And
we are doing a promotion. Did you talk about that already or no?
Yes.
Yeah.
No.
Yeah. Justine 50, Justine, our wonderful hostess. Justine 50 will get you 50% off the adrenal fatigue course, since that's our favorite one, right, Justine? Yes. 50% off the course. So, and that's to the end of February. So you have a couple weeks. Okay. So take advantage of that discount and give us some feedback. We would love to hear how the course was helpful, not helpful. We want to make sure it's relevant and helpful. So let us know. Use the coupon, take the course. Let us know what you think.
Okay. Awesome. Perfect. I did not share that yet. So, all right. Well, thank you so much. Thank you guys for joining us, and wishing everyone a wonderful day.
Thank you, Justine.
Thank you.
See you later.
Bye.